Elinest is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, birth control pills may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases. The recommended daily dosage is 1 pill at the same time each day, and it's best to take it with food to help decrease stomach upset. Remember to take it consistently at the same time every day to maximize its effectiveness. Before starting Elinest, be sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Choose a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. Follow the manufacturer's directions for your specific brand. It is crucial to continue taking this medication exactly as prescribed by your doctor. With certain brands of birth control pills, the amount of estrogen and progestin in each active tablet will vary at different times in the cycle. It is very important that you follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea, you may need to use a backup birth control method, such as condoms or spermicide. Check the patient information leaflet for more details. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea. You may choose to take this medication at another time of day that is easier for you to remember, but it is important to take it at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. After you have taken the last inactive tablet in the pack or gone 7 days without taking an active tablet, start a new pack the next day whether or not you have your period. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Consult your doctor or pharmacist about how to switch from other forms of hormonal birth control to Elinest. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Elinest include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, and weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Elinest may also raise your blood pressure, so it's important to regularly check your blood pressure and inform your doctor if the results are high. Seek medical attention right away if you experience any serious side effects, such as lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. In rare cases, Elinest may cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. It's important to seek immediate medical help if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath/rapid breathing, unusual headaches, weakness on one side of the body, or vision problems/changes. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you smoke cigarettes or use tobacco and are over 35 years old, do not use Elinest. Smoking can increase the risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like Elinest. The risk of these serious problems increases with age and the number of cigarettes smoked. It is important not to smoke or use tobacco while taking Elinest. Always follow your doctor's recommendations and take Elinest exactly as prescribed. Typically, Elinest is taken once daily, at the same time each day. It is important to take Elinest consistently to maximize its effectiveness. Be sure to consult with your healthcare provider for the best time to take Elinest. Before taking Elinest, make sure to inform your doctor or pharmacist if you are allergic to any estrogens or progestins, or if you have any other allergies. It's important to also discuss your medical history, especially if you have a history of blood clots, high blood pressure, cancer, diabetes, or liver disease. If you have diabetes, this medication may affect your blood sugar levels, so it's important to monitor your blood sugar regularly and inform your doctor of any changes. Additionally, if you have diabetes or phenylketonuria, be cautious with chewable tablets that contain sugar and/or aspartame. It's important to inform your doctor if you will be undergoing surgery, will be confined to a bed or chair for a long time, or if you are using any other medications or herbal products. Elinest may also cause blotchy, dark areas on your face and skin when exposed to sunlight, so it's crucial to limit your time in the sun and use sunscreen. If you wear contact lenses, be aware that Elinest may cause vision problems or difficulty wearing your lenses, so contact your eye doctor if you experience any issues. It's also important to note that it may take longer for you to become pregnant after stopping Elinest, so consult your doctor if you have any concerns about pregnancy. Elinest should not be used during pregnancy, and if you become pregnant while taking it, inform your doctor right away. This medication may also decrease breast milk production, so consult your doctor before breastfeeding. It is important to be aware of potential drug interactions that may affect how Elinest works or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Elinest include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Some drugs may also cause hormonal birth control to work less effectively, resulting in a potential risk of pregnancy. It is important to discuss with your doctor if you start any new drug and if you should use additional reliable birth control. Additionally, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working effectively. It is also important to note that Elinest may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are taking this medication. Always follow your doctor's recommendations and instructions for taking Elinest. If someone has taken too much Elinest and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share Elinest with others. While taking Elinest, make sure to have regular complete physical exams, including lab and/or medical tests such as blood pressure, breast exams, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts and report any lumps right away. It's important to keep all medical and lab appointments. If you have any questions, consult your doctor for more details. If you miss a dose of Elinest, refer to the product package information for advice on what to do. You may need to use backup birth control, such as condoms or spermicide, to prevent pregnancy. If you have any questions, be sure to ask your doctor or pharmacist for guidance. If you find that you frequently forget to take your pills as directed, it's important to contact your doctor to discuss possibly switching to another form of birth control. It's important to store Elinest at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When you no longer need the medication or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember not to flush Elinest down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.